Hi, my name is Sarita. I'm one of the students of HAS 820, and this is my audio presentation on aging population in Australia and public health issues. To begin with the introduction, the terms elderly and aged mean people who are over 65 years of age. As we all know that older people make a considerable proportion of Australia's population, and it is assumed that if Australia's older generation continues to grow as it is growing now, it is projected to be more than double by the year 2057. According to Australian Institute of Health and Welfare in 2018, the aging of the population creates both pressures and opportunities for Australia's health and welfare sectors. So, with the increasing aging population or people living longer, people are always facing various diseases and conditions until their end of life. So, I have chosen five major diseases that are most common in the elderly population in Australia. The first one is coronary heart disease. Coronary heart disease is blockage in the supply of blood due to buildup of fats in the coronary arteries. It has two major forms, which is heart attack and angina. According to AIHW in 2018, coronary heart disease is the top leading cause of death in both men and women aged 65 years and above in Australia. However, it's always higher in men than in women. So men have 1.9 times the burden of coronary heart disease in comparison to women. Due to the increase in the aging population or people living longer, the chance of getting this fatal disease is getting higher. However, coronary heart disease is largely preventable as most of its risk factors are modifiable. So we'll be discussing about the risk factors and modifiable risk factors later in our presentation. The second one is heart failure. Heart failure is also growing rapidly in Australia, especially in elderly population who are above 45 years old. This not only impacts the health of the population, but also has economic and social impacts on the individual themselves, the family, and the community. According to a study by Yin Kai Chin, he states that approximately 61,000 adult Australians who are aged 45 and above are diagnosed with heart failure every year. However, despite this fact, the Australian healthcare system still remains ill prepared to detect, prevent, and manage this disabling and costly syndrome. The third one is age-related neurodegenerative disorders. There are a few neurodegenerative disorders in elderly, and I have chosen the most common ones in the elderly population. The first one is Parkinson's disease. Parkinson's disease is the disease of the central nervous system, which mainly affects the nerve cell of the brain. In Australia, the incidence of Parkinson's disease is approximately 8,900 cases every year, and it is slightly common in men than in women. Population in Parkinson's disease are often admitted to hospital more frequently and have longer stays in comparison to the general population. The 75 and to 84 years old elderly are the most affected age group of Parkinson's disease. So the second one is Alzheimer's disease. Alzheimer's disease is the most common neurodegenerative disorder as well, and it affects the elderly population and is a surging public health issues. It can also be considered as the disease of 21st century. Alzheimer's disease and dementia, related dementia, is the second leading cause of death in Australia. The last one we're discussing is asthma. Asthma is a disease of the airways which is mostly triggered by cold air, exercise, and pollens. It is also common in the people who are 65 years and above, as it is in adults. However, most of the elderly population are often misdiagnosed or they miss the diagnosis from the doctors. So this untreated asthma leaves elderly population at more risk. According to a survey which was conducted in the remote Australia, people over 55 years or older, almost half of the population experienced shortness of breath. However, they were not aware about the primary symptoms of asthma, so which kept the population at higher risk of getting untreated asthma. So now we'll be discussing about the public health implications. For coronary heart disease, the nation has developed a national strategic action plan for heart disease and stroke, which is still under development. This action plan aims to reflect priorities and identify implementable actions to reduce the impact of coronary heart disease in the community. In addition, public awareness to avoid sedentary lifestyles is always important. As we discussed earlier in our presentation, that coronary heart disease has the modifiable risk factors. So this includes changing our lifestyles, like eating healthy food, doing exercise, getting up early in the morning, avoiding alcohol and smoking, and so on. So second is heart failure. The Australian government, despite heart failure being such a big issue, they have not done as much as they should be doing. So they should focus on research efforts and preventative healthcare programs. In addition, there are few management that are proven to have a cost-effective outcomes in heart failure, such as gold standard therapeutics devices, telemonitoring, and nurse leading multidisciplinary programs of care. So the Australian government should be focusing on these issues as well, this solution as well. So for Parkinson's disease, as we all know that Parkinson's disease is not curable, all we can do is manage the symptoms and minimize its complications. So there should be a multidisciplinary teamwork to do that. Likewise, adherence to medication is very important in Parkinson's disease. So we need to give education to the family, to the carer, and the individual themselves to take their medication on time and notify about side effects of not taking the medication. Likewise, digital health pathways in future is always a great hope for Parkinson's disease. Likewise, in Australia, in Alzheimer's disease, acetylcholinesterase inhibitors are currently being used to delay the symptoms of cognitive and functional decline. However, due to the dementia, the rate of adherence to medication is very low in such situation. So there are always sectors that help us to deal with the people who have dementia. So, for example, Dementia Australia provides information and assistance with the treatment, services, and education to deal with the patients who have dementia. So, which makes it easier to provide them medication and to take care of them. Likewise, the Australian government also should focus on increasing the recruitment of skilled registered nurses who work in aged care and hospital setting, because the patient or the person with Alzheimer's disease needs a very special care, and this can only be done with skilled individuals, skilled professional registered nurses. Likewise for asthma, so an untreated asthma can worsen the lung functions very faster. So we need to give education to the older population to how to about identifying the asthma and providing education about the key symptoms of asthma, so that it can be identified at an early stage and can be managed well. So, public awareness at an early age to prevent asthma is very, very important. Likewise, there is always a great role, bigger role of the government in prevention and management of the public health issues. There are some government programs which are in place, such as community aged care packages to support elderly population at their own home, where they feel more comfortable and they are always cared in their familiar environment. However, there are some gaps in availability and service delivery. So administrative costs of some community aged care packages are too high, and reducing the amount of subsidy available to funds hours of care. And a trial of consumer-directed aged care packages has commenced, and it is too early to tell whether it has been successful or not. So hopefully, it will be a great success in future, and our aged care population will be receiving consumer directed well directed care in future. Likewise, the aged care providers are always arguing about the low subsidy from the government. This always affects the recruitment of skilled health professionals to look after our elderly population. So government should be focusing on providing good financial support to those aged care providers, which will directly affect in the health of our elderly population. So to conclude, the aging population is a wide concern, and due to population aging, demand is expected to outstrip in supply in the next 30 years. So along with the increasing population, healthcare paradigm is also shifting to a new era. So the demand of our older population should be at an affordable cost, and every elderly population should receive appropriate health access, treatment, care, and support. And there should be a recruitment of skilled and qualified aged care workers, and there's always a role of every individual, family, community, and government for a healthier and for great for a healthier elderly population. So these are the references that I used for my presentation. At last, I want to thank you for your time, for listening to me,